welcome back to the channel. Today, the question I'm getting is, should women be taking testosterone? Like really? What do women need testosterone for? So let's address that. I'm Dr. Chinuade Olusegun. I am an internal medicine doctor here at Angelic, and my practice focuses on helping women and men balance their hormones, live longer, help lose weight, help detoxify the body, help with glowing skin, and a bunch of more stuff, okay? All right, so if you're new here, click subscribe and let's get into this topic. So this is a big one for my practice because I do see a huge amount of female patients, you know, something like 70-30, where my patient population is women between the age of 30 and, 90, okay? So we constantly have to have this debate with every patient when I get their lab result back, because I start screening my patients for hormone imbalance in their 20s. Okay, I want to know where you are when things are optimal, so I know how to really address it when you get older and when things starts to break down, right? So I know what your baseline optimal numbers are when you were feeling good and everything was great in your 20s. I want to bring you back to that number when you're not feeling so great. So I like to screen starting very early. But for my patients that are joining me later in life, well, nobody screened you in the past, so I kind of have to go with what I consider optimal ranges in terms of what numbers to bring you back to. So when I start going over lab results, I get this question all the time, or this strange look from my patients, my new female patients, going, testosterone? Like, that's something I need? And I go, well, yeah, we need it. In fact, men and women all have the same hormones. It's just the ratios that are different. Okay, so for men, yeah, we want their testosterone all the way to 1200, but no lower than 300, right? But for women, we think we don't need any testosterone. Okay, that is completely not true. And so the most fear that women have is, oh, doesn't testosterone cause acne and facial hair and thick voice and clitoral enlargement? I said, yeah, if someone gave you way too much, like a meal dose, but we're not doing that. We're trying to get your level to optimal female levels. So what does that really mean? So here's the controversy. When you look at a lab work and how testosterone is measured, how estrogen is measured, and how progesterone is measured, there is a very unique change in the unit of measure, okay? Pay attention, go grab your lab report. Pause this video and go grab it. The last time the doctor checked his hormone levels. And look at the unit of measure. For your testosterone, it's gonna say something like ng, which stands for nanogram. And for your estrogen, for some reason, it's gonna say pg, which stands for picogram. And then you go to your progesterone, and then it's going to go back to that same nanogram. And so when you're comparing the numbers, you're going, oh, normal testosterone, between, 2 and 82 nanogram per deciliter. But estrogen can be anywhere from 0 to like 300-400. But wait, we're not using the same units. So let's convert it to the same units. 1 nanogram is 1,000 picogram. I repeat, 1 nanogram is 1,000 picogram. What does that mean? Well, that means that we have way more, thousands more of testosterone in our body as a female than we have estrogen. I'm going to stop there and let that sink in. Yes, I said it. We have way more testosterone in our body as females than we have estrogen. So what is this debate about whether women need testosterone? We need testosterone. God gave us thousands more. Okay? We just faked ourselves out by changing the unit of measure. Okay, because if we had kept the unit of measure the same, we would have seen that we only have traces of estrogen compared to testosterone. And our focus, the whole focus of hormone replacement therapy in most of your doctor's offices, most of your GYN offices is giving you estrogen, estrogen, estrogen. And we know estrogen is a proliferative hormone. It makes things grow. And we sometimes don't need things to grow. We're already overweight. We're already have dense breast tissue. We don't need more estrogen to then start causing cancers in these places. Okay? So sometimes the treatment is not estrogen. We need to look at what the testosterone level is and address it. Okay? So I'm going to go back and explain again that women have more testosterone in their body than estrogen. Okay? So we need testosterone. We need it. It helps us burn fat. It helps us with libido. It helps us not sweat at night. It helps us with body temperature regulation. It helps us build muscle. It helps us with building bone. It helps our skin not wrinkle. It helps us with vaginal dryness. It helps us with energy. I can keep going, okay? We have a lot of need for testosterone. You have trouble burning belly fat? You need testosterone. Okay, so I'm telling you, this is not something women should be afraid of. We need to embrace this and get our levels back to optimal. If you check your testosterone level and you are low in the range, you need to talk to your doctor about supplementing it with the natural bioidentical testosterone to help you bring your level to the higher end of the range. So you can start feeling better, sleeping better, having more energy, having more fat burn, having more, less muscle soreness after you exercise, and so on and so forth, okay? So again, do women need estrogen? The answer is absolutely yes, okay? You need it. You need it, you need it, all right? So again, go back to those units of measure, check your lab work, see where the issue is. If we had kept the units of measure the same, women would have known they needed testosterone. And all those side effects that you're afraid of, let me correct it right now. Those come from people giving you way too much testosterone. If you start having acne, huge amount of facial hair, clitoral enlargement, whoever is replacing your hormone is going overboard, okay? It's way too much. We're not trying to make super heroes of women or super therapeutic levels. We just want to bring your level back to where it was when you were in your 20s, when things were working right, okay? That's still keeping you in that therapeutic range, that normal range. We just want it to be on the higher end of that range so that you're getting all those benefits I just mentioned, okay? That's really all, right? Look at your unit of measure of progesterone. That's measured correctly, is measured the same way testosterone is measured. Why did they change the estrogen?